Next presenter is Dr. Anaga Murali. She is presenting a paper on association between primary glaucomas and retinal vein occlusions.
Good morning. My topic is association between primary glaucomas and retinal vein occlusions. So retinal vein occlusion is the second most commonest retinal vascular disease after diabetic retinopathy, which is divided into CRVO, BRVO and HRVO. And there are several risk factors which includes ocular as well as a systemic. The major ocular risk factor is glaucoma, external retrobulbar compression with neoplasm and retinal arteriolar narrowing, which can be secondary to systemic risk factors like hypertension, age, dyslipidemia, diabetes, etc. And the overall frequency of primary angle closure glaucoma was found much higher in patients with retinal vein occlusions higher than in the general population. It was postulated that eyes with primary angle closure glaucoma may undergo mechanical changes in the lamina cribrosa, resulting in retinal vein occlusions, and the raised IOP can compromise retinal vein outflow and produce stasis. And several population-based studies have shown that changes in retinal vasculature are associated with optic nerve damage and glaucoma. And in this study, the patients who are presenting with painless defective vision, who had with or without RAPD and all the fundus examination corresponding to the retinal vein occlusions, they were diagnosed as retinal vein occlusions. And the objective of my study was to determine the proportion of primary glaucomas, that is a primary open angle and primary angle closure disease in patients with retinal vein occlusions. It was a descriptive cross-sectional study conducted over 1 year, and all the patients who are diagnosed with retinal vein occlusions at our institution during the study period was taken. And the sample size was calculated using a similar study done at Nepal, and the sample size was calculated as 334 and loss to attrition was 12, hence the total sample size reduced to 322. And all the cases of CRVO, BRVO, HRVO presenting within 1 year of onset was included, and all those who were diagnosed more than 1 year and all other causes of secondary glaucoma were excluded. And consecutive sampling was done. After getting approval from the IRB, the informed consent was taken from all the patients, and detailed ophthalmological examination was done, slit lamp examination, applanation tonometry, gonioscopy, fundus examination, and they were classified as primary open angle or primary angle closure disease. HFA was used for perimetry. OCT was taken for RNFL thickness and macular edema quantification, and the data was analyzed using SPSS version 23. And the results was, the first result is, among the 322 cases studied, 196 were BRVO, 108 were CRVO and 18 were HRVO. And sex-wise distribution, we could see that the males were more commonly affected compared with the females, accounting for 64.29%. And age-wise distribution, here we can see more than 40 years, majority of the patients were in the category more than 40 years. That is, more than half of the patients came in the category of more than 60 years. Between 40 to 60 years, 131 cases were recorded. And the association between primary glaucomas and retinal vein occlusions, that is a total of 190 patients out of the 322 had primary glaucomas, that is 59.07%, out of which 98 patients, that is a 30.43%, had primary angle closure disease. 92 patients had primary open angle glaucoma, 28.57%. This is a CRVO. In 33.3% had primary angle closure disease, and 31.48% had primary open angle glaucoma. In BRVO, 28.57% had the primary angle closure disease, and 27.04% had primary open angle glaucoma. In HRVO, 33.3% had primary angle closure disease, and 27.7% had primary open angle glaucoma. And among the 322 samples, the 64.29% were males, and the results were similar to our parent study conducted by D. Sherpa et al. And in our study, majority of the patients were above 60 years, and it was also similar to that of the study conducted by D. Sherpa et al. And from our study, we could conclude that the retinal vein occlusions were predominantly a disease of the elderly. And also, in our study, 28.57% patients had POAG and 30.43% had PACD. PACD is more prevalent in retinal vein occlusions than POAG. The proportion of retinal vein occlusion obtained in our study was higher than the similar study conducted by D. Sherpa et al., which was 24%. And so the conclusions from my study is retinal vein occlusions are more common in elderly individuals, especially above 60 years with male sex predilection. And the proportion of primary glaucomas in my study population with retinal vein occlusion was found to be 59.07%, which is quite alarming. 30.43% of the study population had primary angle closure disease, which includes 5 cases of primary angle closure glaucoma and 14 cases of primary angle closure suspect. 28.57% of the study population had primary open angle glaucoma. So while dealing with all these cases, we have to evaluate both the cases, that is retinal vein occlusion. Glaucoma also needs to be evaluated because both of these diseases are potentially blinding diseases, and early presentation to ophthalmologists as well as early diagnosis, treatment and prevention of the complications of the disease is required. And these are my references. Thank you.
The fact that glaucoma is commonly associated with vein occlusions, everyone knows that. You know that glaucoma can affect the vein at which position of, can you tell me, which area of the part of the vein is getting occluded?
At the lamina cribrosa.
That is actually at the edge of the cup. That's called hemispherical occlusions. Understand now? And you are told PSCD. Which stage of PSCD? The glaucoma stage or a suspect stage or a primary angle closure stage? Which stage is more notorious for getting occlusions? You have, in your study, have you ever seen? You told it's a glaucoma case or they have already had cupping and all everything in primary angle closure these glaucoma cases? Primary angle closure glaucoma, you know the stage is difference. Suspect, then glaucoma, and you know the last stage is glaucoma. Glaucoma means they will have field changes and all, cup changes and all, the disc changes will be there. So you have shown that PSCD is more as commonly associated with
vein occlusion.
Vein occlusions.
Primary angle closure patients were more commonly.
How? Because angle closure glaucoma patients will have permanent increase of intraocular pressure. Open angle glaucoma also will have a permanent increase in intraocular pressure. They can produce vein occlusions. How can I say angle closure is more? Or in your study it is more like that?
Yes, in my study it was more because there will be more angle closure glaucoma patients will present to us with symptoms.
No, primary angle closure, only early stages they will come with, they will have some halos and all. Once they develop the glaucoma stage, I don't think they will have similar to open angle glaucoma only they will appear. Primary angle closure, acute stage, only when they develop acute stage of pain or everything they will come to you. Otherwise they will come only with a history of halos and a transient loss of vision. That don't they can come to you. But I don't know why you have told PSCD has got more, the thing, incidence is more for glaucoma. That's the reason I want to know.
The chances of vessel occlusion, the posterior pressure was.
Okay. So usually the glaucoma produces the vein occlusion, no? Or in the other way around?
Because it can be
that is a pathology you explain, no? But this study is based on the reverse side, no?
Because
you studied on the vein occlusion, how many are having? But this is alarming rate of glaucoma seen in this thing.
Because it can be unnoticed and undiagnosed set of population.
Yeah, many are angle closure suspects in your study. So whether that added to this high number, because sometimes the angle closure suspects are to some extent could be subjective. Also. So that is one thing I was thinking. Okay, thank you.
Thank you.